Welcome to the Zeducation Podcast. Welcome to another episode of the Zeducation Podcast, your go-to for career and leadership development. Today's topic is about from burnout to brilliance, leading through emotional intelligence and mental wellness. Now, burnout is silently eroding teams, crushing morale, and costing businesses millions of dollars. But what if the solution isn't more policies, it's more humanity? In this episode of the Zeducation Podcast, joining us today is Dr. Priyanta Ravi, CEO of New Zealand Medics and Mindwell CBT&Z, a medical leader and psychotherapist with deep expertise in stress, trauma, and system design. She helps organizations flip burnout into brilliance, not just for better mental health, but for high impact performance. So if you lead, manage, or care about people, this episode is your wake up call and your game plan. Hey everyone, welcome to the Zeducation Podcast. Before we dive in, I have a quick favor to ask you. If you enjoy this show and get value from it, help us grow by sharing it. Send it to a friend, post it on social media, and don't forget to follow or subscribe on your favorite podcast platform. The bigger this community gets, the more powerful conversations we can bring you, or to help you unlock new levels of success in your personal and professional life. Thanks for being here, and now let's get into the episode. So thank you for joining us, Dr. Ravi. How are you doing today?
I'm good. Thank you so much for having me.
Wonderful. It's our pleasure. So to kick things off, our audience loves hearing people's career journey and how they ended up where they are today. Can you please give us a brief overview around your career journey and how you ended up becoming a neuropsychologist?
Sure. So very early, I was quite interested in how the brain works. So when I was really, really young, I wanted to be a doctor. And at that time, I only thought that, because I'm born in Fiji and in the islands, you go to the doctor and you always see the doctor with the stethoscope and giving medicines. So I thought that was pretty cool. And that was the only thing a doctor can do. But once my parents moved to New Zealand, I was still quite young. Most of my education happened here. And I used to get exposed to things like the Life Education Caravan. And over time, I got thinking that, I don't have to be a family medicine doctor or a general practitioner. I can do a lot more. So I was interested. And then from high school, I started thinking more about, okay, you're interested in medicine, but which part? Do you want to be a dentist or a gynecologist or an orthodontist? What? So that kind of what's opened my mind. And through, science and work in high school, I was interested in sort of exploring how brain works. Surprisingly, my English really helped, studying English in school, doing the character analysis of different sort of, actors or films, books, novels that we'd reach. So all of that kind of put me into, that zone where I was very curious about how people think, how they work, how they behave. So at university, I decided to take up psychology. I studied that to become a psychologist, and I wanted to focus more on the brain side. Mostly in psychology, what happens is you deal with mental health or mental illnesses. I wanted to look at how the brain works to get there before it's broken. So I kind of deviated into neuroscience and neuropsychology.
Awesome. And so I love that. That's awesome for our audience to learn about your pathway and how you ended up where you are today. Now, you talk about flipping burnout into
Mhm.
brilliance,
Right.
right? Now, tell us what you mean by that and what does that transformation look like in the workplace?
Great. So burnout looks like going from reactivity to resilience. So you will see fewer sick days, but more importantly, you'll see meetings that are more clear. They'll be run with more clarity and not confusion. So leaders making decisive moves without micromanaging, teams that bring energy and thought, not just I'm here, with my laptop and my coffee. So brilliance isn't fluffy stuff. It's when the person's nervous system is wired, it's thinking, it's in a state where it's restful and can actually make decisions that can actually breed for things like innovation, creativity, and that's where you actually get brilliance.
I love that. Now, how do you help people understand their brain? How do you assess whether they're on the brink of burnout or not, or in terms of burnout versus brilliance? Like, there's
Mhm.
got to be a starting point, right?
Right. Yeah, definitely. So my approach actually is I'm not doing full-fledged clinical therapy. So I'm not in a GP practice or, a proper consultation form because I want to see patients before they hit rock bottom. Unfortunately, the way the system has been designed or, it has just evolved into, unfortunately, in the status quo, is the prioritization is when things get too bad. So you'd often feel that people, maybe over time they struggle, then it gets to a point where they're like, okay, something's wrong. And then they get to a point where it's worse and they feel like I need help. And then when they reach that point, the doctor then waits to see if certain things can help. There's a bit of troubleshooting. Once all of that is exhausted, that's when you actually get to a person who's actually in a position to help. But then, in that format, when you go to a clinical psychologist, sometimes it's too difficult to turn things around. It's very difficult to
Mm,
manage, and prevention is better than cure. That's one thing. So by stepping out of that patient clinician sort of format and going and working with people in places where they're experiencing burnout and transforming it there, I'm kind of putting them, it's kind of like, taking you out of ICU before you actually get there. So
mm,
that is the whole situation. So where I see it in workplaces, I see it in teams that are very high performing. So your C-suite leaders, your executives, different professions and sectors. So I see it in lawyers, I see it in clinicians, doctors, nurses, frontline staff that are dealing with high volume work, that are dealing with decision-making fatigue, that have high stakes, involved in each and every movement. That's where I see burnout. But also, everybody matters. It's not a linear hierarchy anymore in the workplace. So even if you think that, I'm at the bottom of the hierarchy, I'm just a junior, I'm just an intern, that doesn't matter. If your environment is such where your organization or your company or the person you're working for is not doing well, it will eventually leak onto you and you will start to feel as though you're lagging behind. You're also going to then feel as though you're busier, you're more stressed, you're more anxious.
mm.
And over time, that affects you mentally and then your body.
Yeah, I love that because when people think of burnout, they think, yes, hitting rock bottom. A lot of people think of this,
Yeah.
even when I think of it. Burnout is when you hit rock bottom, you're stressed, you can't do anything anymore, you don't feel like you can, and and because of that, when you're in that state of mind, like you said, you make poor decisions, you're not thinking properly, and as a result, you're not as productive. You're not reaping in the results that you need because your mind is not in the right state, right? So burnout and what you're doing is flipping that, right? So obviously you talked about prevention is obviously better than curing after the problems happened.
Mm.
What have you seen has been some of the causes of burnout in the workplace or maybe in someone's personal life?
Right. So in the workplace, it's actually quite silent, but it's so silent that it's loud enough to be heard. So when you walk into a room where, you have a meeting and after the meeting there's no chatter. There's nobody who's got a question. There's nobody who's saying, I disagree with this, even if it's a minor disagreement, but there's no reaction. Everybody's just like, oh yeah, okay, let's go. Meeting's done, let's go. That's burnout because that means there's a decision fatigue. You're not able to think with clarity. You cannot focus. You cannot have any attention. And surprisingly, if you look at the performance then of, particular people, teams, groups, then you realize that, hey, for the past couple of months or, the data that you look backwards in retrospect will show that things have been piling up. And mentally, you will feel as though, oh, you will assign a reason to it that maybe this project didn't go well. That's why I feel like this. No, chances are you were suffering from burnout before, whether it's hectic time schedules, maybe you were burdened with too much, maybe your workflow wasn't good, maybe things didn't go as smoothly. And that is what led the project to not work in the first place, rather than the actual outcome of the project then now affecting, and causing burnout. So that is the most salient feature. And individually, people hit burnout very, very holistically. So you'll find, obviously, nowadays everybody's working, which is a wonderful thing. It's great to follow a passion career. It doesn't matter where you go, what job you have, big, small, whatever, as long as, you're working for it, you feel happy, you're doing well for yourself and your family. That's a positive thing. But we're working longer and work is more stressful compared to, say, 15, 20, 25 years ago. For example, now with AI coming in, a lot of businesses changing, workers who've been in the employment workforce, say 15, 20 years, maybe 30, 40 years, they're feeling overwhelmed, not because they don't know their stuff, but the way they were working has changed so much. And that is overwhelming them now. It's causing them to undermine themselves. They feel a lot of stress and anxiety. So you will feel that ultimately, that catches up because it goes into your personal life. You're not being able to have energy to take, time out for yourself, spend time with your family. Your emotions are not very well regulated, not eating well, sleeping well, and eventually
Mm,
it will lead to, more physiological issues. So your body will just react and respond in terms of having poor diet, poor nutrition. And it gets to a stage where you then finally see the GP, or in very sad cases, you have a very big health scare all of a sudden, that this was actually happening silently in your body, but it wasn't
mm.
symptomatic. And that's when the wake up call actually happens. So in the workplace, it's silent but loud enough for you to hear it if you walk in. And in personal life, it can be very easy to mask amidst, doing things for your family, your friends, and everything else to look as though everything is still functioning, but deep down, you know that everything is just cracking.
Yeah, I love that example. What stands out to me there is being able to find ways to not just catch it or see the signs, but also measure it. I went to the doctors this morning just before our podcast interview, just my regular check-in, did my blood work. They gave me my results. Last year in December, my cholesterol was a bit higher than normal, and I was like, "Oh, that's the wake-up call I needed, right? That little assessment there." And I'm like, "Cool." Now I went there this morning and everything's looking really good. Really good. And I'm pretty happy with the progress. Now that just motivates me to keep going. Now that's blood work, right? You've got doctors, nurses, and all these systems and technology to help you assess that. But what about when it comes to emotional, your emotions,
Mm.
your mindset, your mental health, your emotional health, right? Tell us about that. How can it's for people who might be tuning in, this might seem like a complex topic, right? And be like, whoa, what tools do I need? What are some simple ways that people can self-assess themselves, look in the mirror and be like, I need to change something?
Right. Great question. And congratulations on taking note. That was a wonderful example for you to share because it's something simple, but what matters is you chose to take notice and do something about it. And that's step number one. You kind of have to put a stop button, or hit the pause button on life and just be like, what am I doing? Where am I going? What's wrong? Are you really happy with the way things are going? Are you happy with the routine you've set yourself? Are you satisfied? And if you feel that you're not satisfied, something's constantly stressing you out, bothering you, then nail it down. You don't, sometimes it's really hard. And that's one of the things I've picked up in the sessions when we talk to people. You can feel it, but it hasn't reached a point where you can actually verbalize it. And that's why burnout is really important. And having awareness around emotions, emotional intelligence, emotional well-being is also important, because if you don't know how to define it, how to describe it, how are you going to pick it up?
Mhm.
So you rightly said, when we're looking at other forms of medicine, there are objective, tangible, and physiological biomarkers that we can look for. With the psychological things, it's a lot harder. And again, seeing a psychologist or access to a psychologist is often difficult. But also because, this is so widespread, very chronic as well. It's not something that we can fix in a jiffy. Sometimes people are also hesitant because they don't want to commit to it long haul. They feel sort of so fatigued that, I want a quick fix. So if you can reach that point where you can just be like, this is important to me because this is concerning me. It's part of your self-awareness and your, self-love, that I got to do it for myself, because if I keep myself well inside and outside, head and heart, then I can do well for my family and I can also do well for work. That's the starting point.
I love that. I love that. Um, what are some simple things that people can start doing today? Like three simple things that people can start changing or doing today to start improving their well-being and prevent burnout.
Absolutely. If it's got to do with occupational burnout, so burnout related to work, and it's not necessarily issues at home or in your life that you're struggling with, then the first thing you need to do when you're at work is just think about what are the things that I can get rid of. So when we're looking at well-being, mental well-being, particularly, again, I did a differentiation earlier on saying that we're not focusing on mental health because that looks at mental diseases. Quite often things that have been broken in the brain or the systems in the brain that don't work. Now we're focusing on well-being, which is the more psychological aspect of what things make your brain work well so you can function
Mm,
well, so you can be brilliant. So, and when we do that, we don't look at, here's 10 other things that you can do. It's not prescriptive in the sense that go take a walk, go do this, go do that, go do this. We already have, so many things thrown at us, whether it's got to do with health, looking after family. We get a list, sometimes that even when we're sick, you got to do this, you got to do that. If you want to have good skills, or, if you want to have, say, for example, a good appearance, want to have good skin, if you ask questions, the internet, people around you, all these, gurus and experts, they're going to give you a list saying, okay, do this, this, and this. But
mm.
we don't need that. You're already doing too much. That's the thing. So burnout, when we want to look at how to mitigate that or how to kind of hit the pause button and turn towards brilliance, what you do is you ask yourself, without adding more work onto myself mentally as well, that you have another thing that you have to take out time for, what are those things that I can stop doing? So rather than adding, we're going to subtract. Get rid of the things that don't serve you. Get rid of the meetings, the places that you got to be, or the way things work. If this isn't necessary or there's another way around it that's better, choose a better option. So get rid of the stuff that doesn't work. Next is find things that are alternatives if you absolutely must do it, but find things that are more effective. And also be a little bit more conscious when you're doing things, So if sometimes we get a bit too casual about work and I'll do it later or I'll come back to it, think about it, If you can take a 5-minute break because you can't think straight, do that, get up from your workstation, take a walk, do something for 5 minutes, set a timer if you need to, come
Mm.
back, reset, and get it done rather than tucking it away and then realizing that, it's still showing on your screen, but you haven't moved an inch. So those are the three things that I would recommend. Subtract,
I'll,
yeah,
sorry, complete that. Subtract.
then you find an alternative and take a break and complete it if it's absolutely necessary, but don't, stay hung up on it.
I love that. Subtract. Oh, shucks, I just forgot it there. Subtract.
Alternate, find an
Oh, yeah.
alternative.
Subtract, alternate, and then take action and make changes.
Yeah.
I love that. I love that. Really simple. Okay, so Priyanta, you are talking to leaders who listen to this podcast. Okay, now can you just to help with our self-awareness, what are the biggest blind spots that you feel like leaders have when it comes to like workplace stress?
Right. I think leaders amongst themselves, so whether you're a manager or executive, you're in executive leadership, sometimes there's a bit of a mindset where you feel like, you'll be all right because you've got a lot of people to help you with. But, that's not really the case. And sometimes that's counterintuitive because a lot of times other people who are not in your position, even complete strangers, they think or they judge that just because you're a leader, that means, you're just sitting on a chair giving instructions and it's not that much effort. So sometimes that mindset itself can actually stop you from triaging yourself to saying, hey, look, there's a problem. And they confuse coping with capacity. So they think that, oh yeah, I'm doing it. It's not great, but I'm still doing it. And they think that it's all right. But the longer you continue, the more you burn. So those are
Mm.
the silent things that leaders and high performers really mask. And the thing with high performers is they don't necessarily need to be in leadership or in management. Um, Good employees, diligent employees are very hard to get. The ones that get up in the morning, they are absolutely, workers worship type. They're absolutely passionate about what they're doing and they care about, their colleagues, their work. They make sure everything is done to the T. They dot their I's, cross their T's, make sure that the next person that they work with or whoever's partnering with them on a project that they can also help them out, so they give over and above. They have a tendency to go, overextend. And that those are the people that actually mask stress the longest. So what we see there is they will appear to their colleagues, to their friends and family, like, they're doing it great. And you must be like, oh, you're amazing, you can handle it. Um, and then they crash. So for them, it's not a slow burn in the sense that it's not very salient. They are burning, 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 and then it goes down. The burn isn't your, journey down the hill. The burn is your journey up the hill. That's the flip.
Wow. Now, our audience loves examples and stories or case studies. Can you give us an example? You don't have to mention names or numbers, but any
Mhm.
examples where, a client that you've worked with, or their team, you know, they hit like a breaking point and then you were able to intervene and support them and now they're off doing well. Can you give us an example?
Okay, sure. So a senior executive I worked with was unknowingly sort of triggering fear in his team. So there was a lot of tension. There were shutdowns, there was silence in meetings. Also, that kind of led to aggressive behavior in the sense that there was a tone in the room around, him that if you challenge me, um, you're going to be in trouble. And that kind of put people off because, you start worrying. There's sort of, a bystander effect. Nobody else is saying anything. Do I say anything? Am I going to lose my job if I stick up to this person? So when we did this session, we reframed the leadership, from being directive, saying, do this, do that, don't argue with me, to being connected. And that is where the transformation actually happens. This isn't about pointing faults. This is about allowing people to be really, really self-aware of things that are changing their behavior. And they might not actually mean it, but if you, let that go unchecked, which often happens in, organizational hierarchies because there's a power dynamic and people don't feel comfortable challenging that. What it happens is that it lets the other person get away with it and it reinforces negative behavior. So it's no longer then just a psychological symptom. It turns into a behavioral issue, and that leads to workplace conflict, legal issues for the company,
Mm,
compliance, stress, money being lost, productivity being lost because people are arguing. So when we reframe this in a session, we said, let's transform your leadership from being directive, telling people what to do, to actually staying connected and focusing on what things we need to do together as opposed to do this, do that. So when we reframe the leadership and the leadership style, within 3 weeks, the project flow increased, the staff attrition was reversed. So then we found that every time a team meeting was called, people would actually turn up and they wouldn't find excuses anymore because they felt a shift and they thought, today's energy, it was good to walk in the room and not get yelled at. I really liked what he was saying. This makes sense. This was my suggestion that I, put in a long time ago. And slowly, slowly, people started re-engaging with the person, not because of quick solutions, but because the tone had changed, and it was more empathetic. So
mm.
without sort of pointing fingers at each other, if we just focus on the solution at hand, which is how can we make sure you can communicate with people around you and do your job better, it works for both parties well. So the shift wasn't really a strategy, it was just developing self-awareness. So obviously at 3 weeks we noticed a very big difference. By 6 weeks, we noticed that we don't have to train them as much as long as they understood what self-awareness was looking like. The issues
Mm.
that had come up before with staff not having a good cohesion in the team, everybody not coming into a consensus, there was actually more dialogue now and more confidence saying that I don't agree with this idea. And people were, thinking more along the lines of, how can we help each other?
I love what a powerful example, and I appreciate you sharing that. And what an awesome turnaround for that person there, and great work that you've done. But that's an awesome example, and it highlights that self-awareness
Mm.
and growth go hand in hand. There's a correlation there. If you're not being self-aware, if you're not taking time to reflect or improve yourself or work on yourself, then how can you better support your team? How can you grow as a leader if you're not growing yourself, right? And it can be a hard pill to swallow for leaders. Like sometimes you've got to look at yourself and ask yourself, are you the reason your team are experiencing stress or burnout? That kind
Mm.
of thing, right? How you're treating them, how you're communicating them with them, how you lead with them. So yeah, I think that's a great example there. Now, for you mentioned earlier, there's a difference between, well-being, which is a lot more psychological, a lot more holistic. So there's a difference between well-being and mental health. Now, I hear these two words used interchangeably all the time, right? And it can be quite confusing for a lot of people. Now, again, you've mentioned, if you can break it down again a lot more simply, the difference between well-being and mental health, and why does this matter for companies?
Right, absolutely. So, to mental health, as we know it on television, social media, whatever's out there in pop culture, it is not about depression. It is not about feeling bad or feeling low. Mental health is about diagnosing real problems with your brain. So it
Mm,
can be neurological, it has to do with the anatomy of your brain, the way it functions. It can be genetic. It's more hardcore stuff. Um, Psychological well-being focuses not when parts of the brain is broken or the way it's supposed to function is not working, but is focusing more on, how can I use my mind, my brain, to be more aligned? And once we get that alignment between yourself, which is your mind, and your brain, that's when you get brilliance because you're doing what you want, you're thinking more clearly, you're not going in two different directions. And that, helps you because you can understand your behavior. And once you can understand things, you can control them, you can adjust them. So it actually gives you the remote in your hand when we look
mm,
at, psychological well-being and understanding yourself. So if businesses only focus on mental health, they'll always be firefighting because you'll always wait for things to go bad and sort of sit there thinking, oh no, you're not crashing yet, or you're not crashing hard enough.
mm.
You wait until it gets worse, more problems occur, more people get hurt, more fights happen until you realize, okay, that's enough. And then they'll intervene. But the real edge is if you design an environment that sustains people's minds and doesn't just work on patchwork, that's where you get long-term brilliance, more productivity, and it's good for your business.
I love that. Let's pause there for a bit. Now, you mentioned if you create the right environment for people's minds to thrive. Now tell us, how do we create that kind of environment? Speaking to our leaders.
Definitely. And I think leadership is the core of that because any business, it doesn't matter if you're a small business or a bigger one, how many employees you have, how many layers in between you have, doesn't matter. But the person who's at the front, who's the leader, who's directing the team, that person calls the shot and you actually set the tone. That's the most important thing for your business, setting the tone. What kind of people are you attracting? If somehow you're not aware of certain issues around yourself or certain flaws, there are chances you can pick up on the wrong person, either by chance or because you've attracted the wrong person. It's a bit like,
Mm,
if you send mixed signals at the traffic light, the cars are going to crash. So if you keep your signals clear, you'll attract the right people that you'd work with. And that's really important. So where I'm coming from in terms of mental well-being or psychological well-being is that we don't want people, to hire the wrong person, or to put it this way, hire people that fit the role better. So we're not just looking at qualifications, which is a starting point and very
mm,
important across the sector, but we're looking at the soft skills in terms of, the skills this person has, because over time, when you're going to stay in that role, I cannot think of a single job in the world where you're not going to come across stress, you're not going to come across anxiety, you're not going to be demanded to show some sort of resilience. And given that most people have very long working life, even if you change jobs, by the time you retire, 65, if we take that as the cutoff, it's a very, very long time. You're going to feel and encounter stress and anxiety multiple times. So it's worth it to invest in your self-awareness so that every time it pops up, you're like, I got a solution.
mm. Yeah, the more self-aware, the more you can identify it, right?
Definitely.
And then if you can identify something, then you can actually action and change something. You can't change something you can't see or can't identify. Love it.
Mm.
Now, you talked about leadership. It starts with leadership. Leadership sets the tone. I love that. Now, you got a saying that you like, right? It's the saying that you say is treat people as people, not clients or guinea pigs. What does that principle look like? What do you mean by that?
Okay, so when I mean by, treat people like people, not as clients or guinea pigs, even sort of in my profession as, in the clinical setting where you have a doctor or a specialist and then you have a patient. So
Mm,
first they're a patient, but they're also your client. They either paying you or the company you work for, and the money comes out to you in terms of your pay. What happens around the world is somewhere the commercial element takes, center stage, and your clinical best practice, which is, your ability to actually solve people's problems using your medical knowledge or your expertise, that takes a backseat. So sometimes what happens is the clinics or the people running the I guess the show, you could say, the management, they set up a structure where they want you to solve the person's problem, not in one go, but to kind of tell them to come back multiple times, so that the more times you come back, you orbit in their system more, you take more transactions, more money. And doesn't necessarily lead to better outcomes for the patient. And it's not better for you, because the person comes back, your workload, your volume increases, but your productivity doesn't. So it's counterintuitive. It works in the sense that you businesses profit, people don't, and ultimately that profit bleeds into the business, because now you've got burnt out staff, people are complaining, clients have moved away, you've lost business. So it's a sharp, you know quick buck, everything's amazing, great marketing gimmick, but long term this doesn't work in the medical area.
mm,
So some consultants, even privately, they have a tendency of doing that. They'll try and retain staff or retain patients for as long as they can, and their focus isn't, the person I was talking to today was really stressed, and I'm concerned and I want to help. It's more like,
mm,
okay, you're stressed, you're concerned, come back for 3 more sessions. So that's what I
mm,
mean by treat your clients as people. You have to put yourself with empathy in their position, because even if they can afford it, if they can walk away with a solution and feel better, it's by your medical practice, by your, I guess, legal binding for the Hippocratic Oath. That's what you're there for. That's why you joined the profession. But also, in psychology, we have this a tendency, I would say now, that how psychologists work previously was they use a whole bunch of theories that have been designed mostly by, Western, I guess, scholars and experts. from behavioral literature, behavioral analysts, and all of that cognitive, and you piece it all together, right? You use this theory, you use that theory. So if I have a person working, towards me in my office and I have to treat them, what conventional psychology usually does is it applies this toolkit. You take your bag out and you start applying these theories. But the reality is how psychology is supposed to work, and we know this in a modern setting now, is that people don't fit according to your theory or your framework, you know,
Mm,
and nor will their problems, nor will their stress, nor will their anxiety. So, how do we make sure that, when we're dealing with something so unique, so bespoke, and so subjective, how do we
mm,
standardize, clinical care, but not standardize people's problems in the sense that I don't
mm,
treat a person with suicide the same as I treat a person who's got PTSD, So that is why you need to kind of step out a bit and not get carried away in terms of, having a checklist and being really, I would say to the T about it. You have to have that flexibility where you know your foundation from, the theory, the training, and all the work you do in psychology, but also pick and choose what applies to, the person in front of you. Because if you miss
mm,
that, all of a sudden, whatever treatment plan you've gone has has completely masked maybe the seed or the core problem. So you end up treating superficial things rather than the actual problem or the cause. So on surface, the person might be coming for therapy or doing, whatever work that they need to with their specialist. And you're going to get frustrated thinking, I did everything right. I followed the book, but I'm not getting the outcomes. And the person is turning up and then they start getting clinical fatigue in the sense that
mm.
but then you lose interest and you're like, I'm just doing it because I don't have another option, but it's not working for me.
Yeah. Wow, wow. There was a lot there. But what I gained from that, and you're right, Priyanta, there's a lot of different leadership frameworks, different health models and approaches. But, they are useful to a certain point in terms of it's good to, I guess, have different perspectives because that's what different frameworks do. You can look at it from a different angle, a different way, a different style. But like you said, we shouldn't use it to standardize the way that we serve everybody because everyone is different. Every person is different. And that's where what you mean by treat people as people, not clients or guinea pigs. And I always like, look, it might sound cliche, but I always imagine my clients as family. Like that's my brother, my sister. Like if this was my mum right now, what's the best advice or best support I can give that person right now? It's a different ball game, eh? When it's someone that you love, or when it's happening to someone that you love, then you change a little bit, right? So if
Mhm.
we have that perspective, I feel like we're going to be a little bit more empathetic than just treating people as guinea pigs or clients. Now, look, we're drawing towards the end of this podcast, Priyanta. You've just unloaded so many gems here for us, for our audience to take away and improve their leadership and their perspectives and approaches around the difference between well-being and mental health and how they can use those tips that you gave us to better support a better environment for their teams to thrive, especially with their minds. What's your final words of encouragement or takeaway for our audience before we say goodbye?
Sure. So, firstly, thank you to your audience for staying with us so far. And I hope that, there's a bit more curiosity around yourself now, not necessarily, saying that, am I, in that category, not necessarily diagnosing yourself with burnout, but more in the sense like, what's bothering me right now? What do I want to do about it? What solution do you want? And that for me would be, a huge win from, coming here today and having this conversation with you. If I can get people to, reach that point where they can identify something that they want to change and also make a commitment that, okay, I'm going to find some action, find some solutions, and be completely okay with the fact that yes, there's a problem, things are not perfect. I might not get a solution today or tomorrow, but you know what? I'm going to keep working on it. And that would be the biggest win for me.
I love that. And if people want to get in touch with you, reach out, inquire more about your services, how can they do that?
Definitely. So I've got a website for Mindwell, which I can send to you, and we can link to this YouTube podcast. So you can visit me on my website, contact me there. I'm also on LinkedIn, so feel free to connect and send me a DM.
Awesome. Again, thank you so much for your time. Dr. Priyanta Ravi, CEO of New Zealand Medics and Mindwell CBTNZ, medical leader who just talked about flipping burnout to brilliance, leading through emotional intelligence and mental wellness. Thank you so much.
Thank you for having me.
And that's a wrap for today's episode. If this conversation gave you something valuable, do me a favor, share it with someone who needs to hear it. And if you haven't already, hit the follow or subscribe so you never miss an episode. This show is all about helping you unleash your greatness, and the more we grow, the more we can bring you content that truly makes an impact. Thanks for being part of the Education Podcast. Let's keep pushing forward, and I'll see you next time.